Hello everyone, this is Dr. Bhanjan Kumar Sahoo. Now, this is the first part of rapid fire MCQs in anesthesia for NET PG 2022. Before we proceed, please visit my channel mcqs Anesthesia Fast. And you can like, share, and subscribe my channel. Also, press the bell icon for latest notification in my channel. Now, the question number 1: the complication of stellate ganglion block are all except A is mediastinitis, B cardiac arrest, C pneumothorax, D Miller syndrome. The answer is D Miller syndrome. Miller syndrome is a sign of successful stellate ganglion block in which there is a warmth of face and injection of the tympanic membrane. Other signs of successful stellate ganglion block include Horner syndrome, lacrimation, flushing of conjunctiva and sclera, increase in skin temperature, enlarged vein of the arm, flushing of cheek, face, neck and arm, anhidrosis of the face and neck, stuffiness of the nostril. Complications of stellate ganglion block include perforation of esophagus, pneumothorax, cardiac arrest, mediastinitis, intercostal neuralgia. Then question number 2. Thiopentol is contraindicated in all of the following except porphyria, status asthmaticus, pericardial tamponade, penetrating eye injury. The answer is penetrating eye injury. Thiopentol is contraindicated in porphyria, status asthmaticus, pericardial tamponade, and severe shock. It causes centrally mediated respiratory depression. It can cause laryngeal spasm and bronchoconstriction in asthmatics. Thiopentol causes depression of myocardial contractility, peripheral vascular resistance falls, and it can lead to hypotension, which can be exaggerated if there is hypovolemia. Then question number 3. Which of the following anesthetic agents can induce epilepsy? A is sevoflurane, isoflurane, desflurane, and methoxyflurane. The answer is sevoflurane. Enflurane and sevoflurane can induce epilepsy. The effect of is much more pronounced in enflurane. For remembering, enflurane E is equal to E. E for E. Enflurane epilepsy. Both start with E. Enflurane can cause increase in intracranial pressure. Isoflurane can cause coronary steal syndrome. Methoxyflurane is nephrotoxic and can cause high output renal failure. Then question number 4. Which of the following is not a definitive airway? Tracheostomy, orotracheal tube, nasotracheal tube, laryngeal mask airways. And the answer is laryngeal mask airway. Definitive airway. Definitive airway prevents aspiration of gastric content, allows for control of ventilation, and permits delivery of a higher concentration of oxygen. They include endotracheal tubes, nasotracheal, orotracheal, tracheostomy, and cricothyrotomy. Non-definitive airways, they do not protect the patient from gastric aspiration. The concentration of oxygen delivered to the patient is lower, but they have the advantage being easier to insert. They can even facilitate insertion of a definitive airways. Certain laryngeal mask airways are designed to facilitate insertion of endotracheal tubes. For example, laryngeal mask airway, oropharyngeal airway, nasopharyngeal airway. Then question number 5. Anesthetic agents contraindicated in hypotensive is propofol, thiopentone sodium, diazepam, or ketamine. Then answer is ketamine. Ketamine increases heart rate, cardiac output, and blood pressure. These effects are due to stimulation of a sympathetic nervous system and decrease in reuptake of noradrenaline. Hence, it is contraindicated in hypertensive, ischemic heart disease, congestive cardiac failure, aortic arterial aneurysm. It is also contraindicated in patients with increased intracranial tension. It produces dissociative anesthesia. Question number 6. Contraindication to vasoconstrictors in local anesthesia: spinal anesthesia, epidural anesthesia, digital nerve block, and regional anesthesia. That is the answer is digital nerve block. Vasoconstrictors like adrenaline are used with local anesthetics for decreasing the systemic absorption and to increase the local anesthetic concentration duration of the block. But adrenaline should not be used with lignocaine when infiltrating areas of end artery supply. This site includes fingers, toes, pinna, penis, nose. The use of adrenaline in those areas can compromise the blood flow and result in ischemic injury. Then question number 7. Which of the following is correct regarding color coding of anesthetic gases? Oxygen black with gray shoulder, nitrous oxide blue, cyclopropane red, helium orange. And the answer is nitrous oxide blue. Color coding of anesthetic gases: oxygen black with white shoulder, nitrous oxide blue, cyclopropane orange, carbon dioxide gray, nitrogen black, helium brown, air gray body with white and black quartered shoulder. Then question number 8. Which anesthetic agent is preferred in a patient taken for surgery with bilirubin of 8.6 mg per deciliter and serum creatinine of 2.1 mg per deciliter? Atracurium, becurium, pancurium, and rocurium. Answer is atracurium. Atracurium is a preferred muscle relaxant is a patient in liver dysfunction and renal failure. It undergoes non-specific ester hydrolysis and non-enzymatic degradation that is called Hoffman degradation. It does not depend on the liver or kidney for its deactivation. Other muscle relaxants that can given in liver and renal disease are cis-atracurium and mivacurium. Question number 9. The following modes of ventilation may be used for weaning of patients from mechanical ventilation except controlled mechanical ventilation, synchronized intermediate maintenance ventilation, pressure support ventilation, assist control ventilation. The answer is controlled mechanical ventilation. In CMV, the ventilator delivers the tidal volume, the patient effort is not present, hence it is not used for weaning of patient from the ventilator. Then last question, the question number 10. The most appropriate circuit for ventilating spontaneous breathing infant during anesthesia is Jackson-Ridge modification of RET piece, Mapleson A or Magill circuit, Mapleson C or Waters 2 and Proco canister, Bain circuit. The answer is Jackson-Ridge modification of IRT piece, Mapleson D or Bain circuit for adult. Thank you. Please like, share and subscribe my channel. Please subscribe my channel.